Today we are gonna see a topic of cardiac output assessment, where we use it to assess cardiac output. There is a historical types which are used by our ancestors by four types, where it is yeah this is so four methods of measuring cardiac output we follow frequently. So first one is fixed principle, and then indicator dilution method, and then thermodilution method, and also pulse Doppler method where we use it oftenly, and also flow meter method. It is also available but only for animals. So what we have to do is we have to go through these all things, and also non-invasive method. There is two types of methods where we can see fixed method, dye dilution method, thermodilution method, and trans-esophageal echo method as invasive method, and also non-invasive method, Doppler echocardiography. So fixed principle is nothing but where we use it to take organ by a unit of time is equal to atrial difference is also calculated, and also the difference between the oxygen demand, which is mean by cardiac output, nothing but the procedure nothing but a brachial vein and also a right atrium. When a catheter is passed through the brachial artery, we have to get the brachial punch where we use it to assess the pulmonary artery. Okay, and then the advantages of fixed principle, where we use the invasive method, so we can able to cannulate the person where we can lead to risk of infections and also hemorrhage. It can be used for critically ill patients. Okay, and then calculations. There is a calculation of cardiac output is equal to 5 letters where we can use it to calculate it, for example, and then indicator dilution method or indicator dye dilution method where it is used for calculate cardiac output by dye injection dividing by time concentration, where we can use it here as a graph, so we can able to easily identify how many seconds it can happen to inject a dye and how many times it can able to reach multiple of it. So thermodilution method is nothing but a thermal dilution. A cold saline is diluted in the pulmonary artery where we can able to use for the temperature changes that can be measured by using thermistor. Yeah, here it is pulmonary artery catheter as well as Swengan's catheter. So where there is thermistor port, we can able to easily assess the temperature of the cold saline and also the cardiac system, and also the advantages and the disadvantages. Advantages nothing but cardiac output may be get measured low one, and also we use here saline solution. So here it is a harmless procedure, we can able to use it. And also the disadvantages, thermodilution method, it is an invasive method where we can able to use require cardiac catheterization so that the patient may be suffer as well, right? So that is the disadvantages that is in this method. And also pulse Doppler method. Pulse Doppler method refers to a transthoracic echography, nothing but transthoracic and also trans-esophageal echography. There are two types of echography methods we can able to use it, and also an ultrasound where we can able to look up tissues and also the organs inside our chest and also a heart. Trans-esophageal echography, where it is an invasive procedure where we can able to invasively put an incision and also make a surgery type of techniques, so that it is called as invasive method. Where it is advantages is nothing but we can able to use it during cardiac surgeries, and also the disadvantages is in invasive method, so we cannot get an accurate uh, interruption where we can able to assess while in transthoracic echography. When compared to transthoracic echocardiography, it is a standard method. We can use it regularly in a medical professions. Okay, it is a non-invasive procedure. When compared to invasive procedure, it is more simple, and also by using pulsed array probe, we can able to tilt and rotate the probe, so we can able to assess the patient easily. And the advantages: it is a non-invasive procedure done frequently, so the structure and the abnormalities of the muscle and the movement and the cardiac output can be easily monitored. And also the disadvantages is nothing but the cardiac surgery could not be possible to do while the thoracic echocardiography could be done. These are the methods that we can able to assess cardiac output by using echocardiography. When come to parasternal long axis view, there is a parasternal long axis view where we can able to assess aortic valve and also a left ventricle. In between the left ventricular outflow tract, where we can able to assess this. Yeah, here. So we can able to assess. We can able to measure the left ventricular flow tract, where we can able to use cardiac output is equal to heart rate into stroke volume, where stroke volume leads to this formula, so that we can able to assess this now. Now measuring of cardiac output. Cardiac output measuring is nothing but stroke volume is equal to LVOT area into LVOT VTI, where we can able to see LVOT area in the previous slide. Now we have to go through LVO2 VTI, nothing but in this apical 5-chamber view, we can able to assess aortic valve, so that the aorta here, so it will help you to measure pulse wave Doppler, where it can be interrupt to that. So we can able to assess like this, yeah, like this in this below pulse wave Doppler imaging, we can able to assess this, and then we can able to measure LVOT VTI. So we can able to measure these all things, calculate LVOT area and also calculate LVOT VTI. So hence we can able to calculate both of these, and also we can able to apply this to cardiac output. So is cardiac output is equal to LVOT area into LVOT VTI into 100. So we can able to easily get a cardiac output by using in this real generations that are grown through. Which can be used by frequently here, but we can't able to do anything like calculation or something else. The machine itself can help you to calculate the method and also the cardiac output, where it is otherwise known as the ejection fraction for a patient to help it a lot to understand. Understanding it's for understanding interpretation like mild, moderate, and also severe LV dysfunctions. Okay, it can be helpful for the patient for it, which leads to heart failure. So that's a class today. We can able to go through this, and also the non-invasive method which can be used to animals, not on human being. So flow meter, okay, that flow meter, it is an electromagnet flow meter device which is inserted cannula through the aorta by the pulmonary vein. So what we have to do is we have to insert to an animal, not to an human body. So better we can avoid it. Thank you all.